I'm Alpesh Kothari. I'm a consultant paediatric orthopaedic surgeon. I work in Oxford. So I wanted to become a doctor because not only did I enjoy the scientific aspects of the discipline, I also enjoyed working with people and the practical aspects, hence why I became a surgeon. So I think being a paediatric orthopedic surgeon is extremely rewarding. Working with children is fantastic. They're very honest. If there's a problem, you'll know about it. And if there isn't, they'll just get on with things. And that's brilliant. I think timely intervention, if a child has a problem, can sort them out and then they can have a completely normal life. And so that's many years we're looking at of normal life. And that's fantastic. The other thing is that when you're dealing with children, you're also dealing with the parents and they have their concerns and their anxieties. So you're in a privileged position, I would say, that you can treat children, but you're also dealing with the parents and hopefully allaying their fears and anxieties. And so you're treating a big group of people, and that's a good thing. What I find most rewarding about my job is a slightly difficult question to answer. There are lots of things I find rewarding, but I think in simple terms, if a child comes into clinic with a problem that I can personally manage, they have a pain, disability, and they can't participate with their peers, and then I can intervene either non-operatively or operatively, but treat them accordingly, sort out their problem, and then they get back to a normal life. So that's particularly rewarding. So I think looking at the feedback that I've got from my patients and parents over the years, what they value from me is that I actually listen to what the problem is and I acknowledge what their concerns are. And also, I don't address the parent as well. It's really important to put the child in the sort of focus of everything. And that obviously that is why we're doing what we're doing. I think they also realize I've got three small children, so they also realize that I'm in the same boat. I have my own concerns and fears about my children, so I can really empathize with them. And I'd like to think that the empathy is what they really value. And with regards to what I value about them, I think I mentioned it earlier. I just like the honesty. If there's a problem, they'll tell you about it. They're not malingerers. They've got no ulterior motives. They just want to get back to playing, being with their friends, going to school and getting on with life. And hopefully I can facilitate that. So one thing I always endeavor to do is listen to my patients and the parents. So particularly on the ward, but also in clinic, when we get to the end of the consultation or the ward round, I always ask the parents and the child, have you got any questions, queries, or concerns? Because what I don't want to do is leave there assuming everything's fine and then they've got some unanswered questions or they have issues that remain unresolved. Essentially, that can just lead to confusion and problems further down the line. And I want to make sure we have clarity on both sides and essentially that we're both singing from the same song sheet.